we recruit and train local volunteers to support the mom start from 5 to 6 month pregnancy to up until the baby is 6 weeks old. So the volunteer provide antenatal support, postnatal support, and during the birth as well. And they receive accredited level 3 doula skills and breastfeeding skills training from us in order to carry out this role as a volunteer. Moms are local moms who live in Tower Hamlets and giving birth in Tower Hamlets. They vulnerable mom, many different types. For example, single mom, where is some domestic violence involved, mental health history, who had a traumatic birth before, or who had a first child and she's expecting the second child, but she has only the husband who is in this country. She doesn't have no family, friends. So the husband has to look after the kids and she's got no one to be with her during the birth. And the moms who cannot speak English because they don't know anything, they're new to the country, they don't know about the NHS services, they don't know about the labour words, anything. So the maternity maids and help them to encourage them to attend all their antenatal appointments, antenatal classes in order to increase their knowledge a bit about the labour and childbirth. They make sure that do the birth planning, discuss the pain relief options. They make sure the moms are updated with the hospital policy. When they give birth, they do the hospital tour with the mom as well to make sure the mom is aware of the places where she's going to go when the labour starts and everything. So when the labour starts, the volunteer can be called anytime during 24 hours of the time. So they call about 2, 3 in the morning, and 2 maternity mates work with 1 mom in case of anything emergency come up. So they both take turn, and they take turn in shift, like 4 to 5 hours shift with moms, because individual cases are different. So we don't know who needs how long time and all that stuff. So they take turn. They help the mom, support the mom in order to progress their labor, in order to help her between the professional and the moms, to give her a comfort, provide her some emotional support. And after the baby born, they support the mom to provide the breastfeeding, and also they make sure the mom had the postnatal checkup. If there anything, refer them to or signpost them to the other agencies like Children's Center, postnatal depression classes, babies massage group, and all those stuff. They make sure everything basically goes well. If mom needs any other supports like housing or social service, anything, they signpost the mom.
I think sometimes you have to try something different. And we do know that where there may be issues of stigma or fear or lack of information, sometimes talking is better than leaflets. Some communities, even though literate, will prefer not to read a piece of information, but to be told it. And I think it also gives communities a chance to ask questions directly, have someone speak to them in their own language if they prefer that, possibly somebody from the same age range. You know, it just makes it easier. We go to places of faith, we go to community centres, community groups, local events, places and at times that statutory professionals may not be able to do. We advertise it through community groups in Redbridge, on our website, through our employment and skills team, and also if we know of any volunteers, we obviously let them know as well in case it's something that they want to try out. They are employed by Redbridge CVS, but as casual workers, they can choose which times are convenient for them. You know, we just say, we have this potential session. I know generally what their rough availability is. We've actually got about 16 at the moment. They're from a wide variety of communities representing those in Redbridge. So languages that they speak, for example, are French, Urdu, Lingala, Tamil, Punjabi, Gujarati. We're still looking for Somali. They also speak Yoruba, Bengali, obviously English. I'm sure I've left some out, and Hindi as well. So quite often they can go and deliver a TB awareness session in the community's preferred language. Sometimes they might use 2 languages at a time, depending on the makeup of the audience. We started off with training 15, that went down to 11. Our target was for 8. So my aim is to try and keep it slightly above the target, because obviously people go according to their own personal commitments. A lot of our health buddies are people who either aren't working at the moment or have family commitments or care commitments or a part-time job. So those sorts of things, we try to be as flexible as possible. So the base level was supposed to be 8. We've always had at least 10 from when we started the project last October. And the current level, we're supposed to have 16. And the only reason I'm saying we've still got 16 is because 3 haven't completed their training yet. So we would have 19.
Okay, I put an advert twice a year in local newspaper called Eastern Life, which is free delivered to everybody's door in Tower Hamlets, and also word of mouth, also advertising the Tower Hamlet Volunteer Centre, also to the GPs. We advertise everywhere. We do attend the workshop and the events and everything. So we do get from the self-referral by word of mouth ongoing. We need only 16 places each time, so twice a year, 32 volunteers. But each time I put an advert in Eastern Life, I get more than 150 calls. People are interested to find out more about the volunteering. And on the open day, I hold an open day, and more than 50 people attend each time. But from the selection process, I had to interview them, screen the application and everything. Then we recruit about 16, 17 of them. All our volunteers are mixed. However, the Tower Hamlets is more Bengali. So we always prioritize to be more Bengali than other cultures. But then is average mixed. So if we have a mixed volunteers, we can match up with like Arabic speaking. We have someone Arabic speaking to match with the moms. So the Bengali speaking, we have someone available to match with the Bengali speaking. So it's working well, recruiting the mixed volunteer. And our clientele is mixed as well. Obviously, more Bengali than any other community.
It helps us to provide information more easily to the people. Especially I can say when I talk to my language people, when I discuss with them and explain them in my language, they feel free to know everything and they ask me more questions rather than when we speak in English.
People have suggested, why can't you put leaflets in the surgery? I wonder if they have ever seen what the surgery bulletin boards are like. There are hundreds of leaflets stuck here and there. And if you leave the leaflets in the surgery, toddlers, babies in the pram, they pull some of these things out and throw it everywhere, and usually they are not read.
I moved into Redbridge in 2010, and it was 2 months after that I had these symptoms, and the first of it was losing weight. That was a drastic measure because I was a size 12, and by the end of my TB I was a size 6, and I was eating and everything, but I was just losing weight, and I was getting really tired and my bones was hurting. So I kept going to and fro to the doctor. I'm a single parent of a child who was there for, so I find it quite hard looking after him and getting out of bed and stuff. My doctor kept telling me different things. It was never a blood test for TB. For 3 years I carried on having the TB. Walking in the street, losing saliva, becoming weak and becoming depressed. And I was already isolated already. And things like getting my child ready for school, I found the biggest chore to do. It was only when I went back to my doctor and I had enough of it because it was bringing me down. I threatened him. I told him I'm going to go to house. And also I have TB on my skin. So I had one biopsy done on my nose where he thought I was told I had skin cancer by the NHS. So that already scared me. And when the results came, I had to go and collect my results. My doctor was supposed to send them to me, but I had to go and collect them. When I was told on the piece of paper I've got TB, I was even more alarmed and I was more angry with my doctor because I've had to carry that for 3 years. Separately, when I was referred to Queen's, and this is the good thing about Queen's Hospital, I will say, as soon as they found out I had TB, this was in November. December, I kept going back there and I was put on medication in February. And the nurses really supported my medication. And even though I had that bad experience with the doctor, what got me through the TB was the support of Bridget, my TB nurse, and the people in Queen's. They were very, very nice because obviously the treatment that you get is worse than the TB. It's the worst type of side effects you can get on tablets, and also you have to take loads of tablets per day. So, but then all of this, I was like, I'm determined to get better and I need to fight this off. And half of it was going to the gym to be positive. So I think this is why I'm doing this, because a lot of people that might have it might think it's the end for them. They might be scared to talk to parents, or like my mum at one point didn't want to share a carton with me because I had TB. So I want to break these barriers down, because I've gone through it and no one was there to educate me. There could be someone like me, like a single parent with a child that's younger, and you know, they're on their own and they're suffering and they don't want to say anything because you get stigmatized. People walk away from you when you tell them you've got TB. It's like leprosy or something like that. So I want to do this. It's very close to my heart, doing this, because I feel like I'm doing something is going to change. It's going to be a positive thing.
It took time to establish the referral pathway. One of our major referrer is a specialist midwife teams called Gateway Midwives, and they are based at the London Hospital. So they are a team of midwives who look after the vulnerable mom in Tower Hamlets. They become the key worker and signed midwife for those people. We do not take all moms who they support, because some moms are assigned to many different services. So it's become too much for the volunteer to take on all the stuff. But whoever the midwives thing, with discussion with myself and my colleague, our team, so whoever appropriate for this project think will benefit, we get with the mom consent. We got hospital midwives teams, we got GPs who refer us as well. We got perinatal team, the mental health team, they refer us as well. Also the children's center. I learned to work directly with the midwife, especially the specialist midwife team. So whoever I got from the specialist midwife teams, they are more perfect for the service. And sometimes, if I get from other places, the referral, sometimes is not appropriate referral. There is a more decline rate. The reason because the person or the organization who referred was not 100% aware of the project or the moms.
In public health, we've always been very concerned that our TB rate was going up. And while we were in the PCT, we commissioned services for management and treatment. We found there was a gap, that we weren't looking at the prevention element or a pathway, referral pathway or anything else. So that was as started. I thought we must work in partnership. And also at that time, we had a TB steering group, which was very much led by acute services. And there wasn't, except public health, there wasn't anyone else involved. So there was a gap, so that's why I started the partnership.
If there are issues to do with, for example, questions that the community has raised, we take back to Redbridge TB Partnership, which includes representation from Redbridge Public Health, Redbridge Clinical Commissioning Group, NHS England, Public Health England, the National Charity TB Alert, and the Welcome Centre, which works with homeless people. So a mixture of statutory and voluntary organisations, and of course Redbridge CVS. And because we can take it back to that sort of group, then things can happen. So, for example, TB leaflets, it was true there weren't any, and so Public Health Redbridge commissioned 9,000 TB leaflets, which were then distributed to all the Redbridge GP practices, pharmacists and dentists. With the BCGs, it became a London-wide thing whereby all babies will now be given BCGs, because it was sort of sporadic depending on the borough, how it was done before, and obviously not being given to the babies at the hospital meant that you were only then chasing up a few who kind of escaped the net, as it were. The GP situation, obviously what it felt was that GPs needed refreshing in their knowledge of TB. And so, again, what's meant to be happening is that Public Health Redbridge and Redbridge Clinical Commissioning Group are meant to be training GPs as part of their learning events that they have, but also will encourage GPs to refresh themselves with online training, which has been developed by the National Charity TB Alert.
We purposely called ours health buddies, but they're mainly going around raising awareness with TB. But that doesn't mean that because we're widely calling them health, we also want to encourage them to do other things. For instance, we're looking at early diagnostic for HIV patients. So it's really raising awareness, using them as a lever, because it's those communities that mainstream clinicians can't access. And also there are lots of myths in communities where we can use the health buddies. So it will evolve. I think the CCG would quite like to use them as diabetes champions, or I would call the prevention of cardiovascular disease. So it all contributes.
last year we supported 60 moms, and this year I'm aiming, this is the second quarter, we've already got nearly 50 moms, so I'm aiming to support about 80.
We're happy that we have had information from TB Alert, the national charity, that they have actually had people from the helplines calling from Redbridge, usually where they've not been able to access their GP, unfortunately, but they have said that how they knew about it was from the health buddies. So we do know that if we say it to one person, they might tell it to other people in their family, and certainly that's what they say they will do, is they'll share it with other people they know. We reached, I think, 2,300 and something people in the pilot period, and we're hoping to carry on reaching as many people as possible.
The biggest change for us is that TB is on the agenda of everyone. Before, it was only public health and TB clinicians would talk about TB. Now everyone talks about TB. And it's not about the stigma of who gets TB. Anyone can get TB, the common messages. So I think that's the most benefit we have gained locally through our local media, local papers.
Hopefully the NHS now, because the first point of call is your doctor, you're not going to go straight to the hospital. So I hope and pray that doctors now, clinicians, and whoever's got that first point of contact with people that are vulnerable, that will say, go and have a blood test or go and have a monox test to rule things out. I think if it happened to me earlier, I mean, the impact of the TB now on me, I have a hole in my lung because of this. I have it from tuberculosis, where if it was diagnosed earlier, maybe it would have got that far.